name is Rezi Edington. I'm a medical student from McMaster University, the Waterloo campus.
And I'm Justin Murphy, a medical student from Memorial University of Newfoundland. We're both here on a sports medicine elective with Dr. Lee and his team at Waterloo Sports Medicine.
During our short time here, we've been seeing a lot of patients coming in with anterior knee pain, or pain that you feel at the front of your knee.
You may have also heard terms such as patellofemoral pain syndrome or runner's knee.
We're here today to show you a few exercises that you can do at home to help with this. Always remember to warm up before engaging in any physical activity. So Justin's going to show me a few exercises to help with patellofemoral pain syndrome. He's going to be giving me some tips on my technique, so hopefully that will help you at home as well.
So we decided to show you 3 simple exercises. We're going to get you to do 8 to 10 repetitions for each and run through it 3 times. So exercise number 1 is the squat. So I'm going to get Rezi to demonstrate that here. And as she comes down, I want you to take note of the fact that we're only using a partial squat. We don't need to go into a deep squat here. The other thing I want to cue Rezi on is her toes, making sure that her knees aren't coming over, because if you do, you're going to put a lot of strain on your knees and add to that discomfort that you're having. The other thing that we often see in clinic when we're getting people to squat for us is their knees often knock in. So I'm going to cue Rezi to make sure she keeps her knees out. If you're having trouble keeping both knees out when you squat, you could always go over to the wall and just get support on the wall and do a single leg squat. So same cues apply here. We're only doing a partial squat, making sure her knees aren't going over her toes. And if she happens to have that knee collapse in, you could sometimes use the wall for that support to help push out. Again, we're using 8 to 10 repetitions here, but in this case where it's only one leg, we do that on the other side as well. So exercise number 2, we call these the monster walks. So what you're going to need at your house is a band like this, but don't worry if you don't have one, because we're going to show another modification that we could do without the band. So I'm going to get Rezi to put them on her, put it on her feet here. And the reason why we put it on the feet, as opposed to sometimes you might see above the ankles or just below or above the knee, is it gives her a cue to kind of make sure she keeps her feet outwards and not let them collapse in. So what I'm going to get Rezi to do now is just to get into a nice partial squat and take a couple steps to her right. Perfect, and back to her left. Excellent, so if she does that 4 or 5 times, that'll get you your 8 to 10 reps. And now remember, if you don't have a band, you could always do this modification, so I'll get Rezi to come down onto the floor here. We call these the clamshell. So we're working that same external hip rotator, those glute meads, but without the band. Now, what I'm going to get her to do now is, with her knee flexed at 90 degrees, feet together, is just to open up the hip, keeping those feet together just like that. So again, she'll do 8 to 10 reps here, and then switch sides. Our final exercise, exercise number 3, is the glute bridge. So what we're going to need you to grab at your house is either a mat or towel, or even just the floor if you find it comfortable to lay on. So I'm going to use a mat with Rezi here, and I'm going to get her down just on her back. A couple things what I want to point out is just to keep your knees flexed at 90 degrees, arms out to the side with your palms facing down. So I'll get Rezi to elevate her hips here, engaging her core and firing those glutes. So as you see, when she raises her hips, she tries to keep that straight line there and lowering again. If you're finding that difficult, you could always open up your base of support a little bit, and sometimes that makes it a little bit easier, but the same rules apply. Engaging that core and firing those glutes, getting 8 to 10 reps once again.
Today we covered 3 basic exercises: the double or single leg squat, the monster walk or clamshell, and the glute bridge. These help to strengthen the muscles involved in knee stabilization. This is an important component of the treatment of patellofemoral pain syndrome.